Stand up right now if you're able to. Go ahead. I'll pause for a second. Now, really focus on how your body feels at this exact moment. Are you aware of any aches, stiffness, extra tiredness, or even small areas of discomfort? A lot of folks pick up on these sensations but tend to push them aside quickly and not think much about them. Here's an important point though. Some of the most serious health problems don't come with loud, obvious alarms. They start with soft, barely noticeable whispers that we can easily overlook until it's harder to intervene successfully. And one of the sneakiest, most dangerous silent warnings frequently originates from your pancreas. That small but vital organ tucked away behind your stomach. I'm Dr. Michael Kent. For over 25 years, my practice has centered on caring for adults age 60 and older. I've seen repeatedly that while getting older does explain many bodily changes, it doesn't explain everything. Serious conditions have a clever habit of disguising themselves as ordinary parts of aging. Pancreatic cancer stands out as an especially stealthy and aggressive example. It begins so quietly, with extremely subtle clues that people often dismiss or chalk up to minor everyday issues. Many imagine pancreatic cancer striking suddenly and dramatically, with severe pain or striking symptoms appearing all at once. But in reality, it's usually much more gradual. It develops slowly over months, revealing itself through quiet, understated signals. Unintentional weight loss with no apparent reason, mild yet persistent discomfort in the back, small ongoing shifts in how digestion works, or fresh difficulties managing blood sugar. Individually, each of these might seem trivial, routine, or just a normal aspect of growing older. But when a few start showing up together and creating a noticeable pattern, they deliver a message that really shouldn't be ignored. Over the next 20 minutes or thereabouts, I'll walk you through the 6-step early protocol that I've developed and refined over many years, designed specifically to help spot these early pancreatic warning signs. This is based directly on solid research and hands-on clinical experience from top places like Johns Hopkins, the Mayo Clinic, and the Cleveland Clinic. The purpose isn't to scare anyone, it's to create genuine, useful awareness so you recognize precisely when those quiet signals from your body call for your attention and a timely visit to your doctor. Before moving on, please leave a quick comment below with just your age. It helps me understand who's watching so I can adjust future explanations to better suit various age groups. Let's start with what's really happening inside your body, described in straightforward, everyday language that not everyone gets to hear. As you move into your 60s, 70s, and beyond, the pancreas experiences natural slow changes. The output of digestive enzymes gradually drops, and its ability to manage insulin for steady blood sugar can become less reliable or smooth. These gradual shifts often begin affecting your appetite, your energy levels, and your capacity to hold a stable weight long before any clear or dramatic symptoms emerge. Picture your digestive system like a busy kitchen that's slowly losing its seasoned workers. When the key enzymes responsible for breaking down fats, proteins, and carbohydrates decrease, food isn't processed as thoroughly as it used to be. Even when you eat the same amounts and kinds of food as before, your body takes in fewer nutrients and calories properly. The result is often a gradual, truly unexplained decline in weight that can catch you off guard and frequently gets noticed by others around you first. You may notice your clothes hanging looser around the waist or chest. Sometimes friends or family mention it before you fully realize it yourself. This shows as a yellowish tint in the skin or the whites of the eyes, frequently accompanied by unusually dark urine or pale clay-colored stools. It occurs when a tumor in the pancreas enlarges sufficiently to press on or block the nearby bile duct, disrupting the regular flow of bile, the substance that helps digest fats. Bile moves steadily from the liver and gallbladder, like a steady stream delivering essential digestive aids. When obstructed, it backs up, leading to the yellowing, itching, and alterations in stool and urine color. Studies from the Cleveland Clinic suggest that in about 65% of cases detected relatively early, jaundice comes after milder symptoms, so noticing it is a strong reason to seek immediate, complete medical assessment. If you see this change, don't wait. Because the pancreas plays such a key role in producing insulin and regulating blood sugar, any impairment in its function can cause unstable glucose levels. This might appear as brand new diabetes starting after age 50 or sudden challenges controlling blood sugar in someone who previously had stable, well-managed diabetes. Insulin functions like a key that unlocks cell doors, allowing sugar to move from the blood into cells for energy. When that mechanism falters, whether from reduced production, irregularity, or other disruption, sugar accumulates in the blood, draining energy and frequently heightening fatigue. Research published in Diabetes Care examined 750 adults experiencing abrupt changes in their diabetes and found that roughly 5% actually had early pancreatic cancer, a rate significantly higher than in the general population. The most common error people make is viewing each symptom in isolation rather than recognizing them as linked elements of a larger picture. Weight loss by itself might seem connected to aging or reduced appetite. Back pain alone could look like a musculoskeletal or posture problem. New or worsening diabetes might appear strictly genetic or tied to lifestyle. But when several signs gather together, that combined pattern turns into a serious alert that requires prompt attention. To illustrate this more clearly, let me share two actual patient examples that demonstrate how these signs play out in real life. First, consider Margaret, who was 68. She had always remained active and self-reliant, taking daily walks, tending her garden, enjoying time with her grandchildren. Then, over just 3 months, she dropped 12 pounds without any effort. She also developed a stubborn, dull ache in her upper back that stretching or rest failed to relieve, and she began feeling overly full after eating only small portions of food she used to enjoy. When she visited me, she was confused and worried, noting that nothing in her daily routine or eating patterns had changed. We immediately put the early protocol into action, closely monitoring her symptoms for a brief period, ordering timely blood tests, arranging appropriate imaging, and offering specific nutritional advice. The blood results revealed elevated liver enzymes, and imaging detected a small lesion in the pancreas. Thanks to catching it relatively early, she underwent surgery with good outcomes. She slowly regained 8 pounds, her energy returned completely, and she later said, "I feel like myself again. I'm so thankful we didn't delay." Then there was Robert, 72 years old, who had controlled his type 2 diabetes effectively for 15 years using medication and consistent habits. But over 6 months, his blood sugars started fluctuating unpredictably even though his routine stayed the same. His stools became pale, greasy, and difficult to flush, and he experienced profound fatigue despite getting plenty of sleep. Initially, he kept it to himself, figuring it was simply aging or maybe related to his meds. When he eventually brought it up, we applied the early protocol to connect the dots. Tests indicated signs of obstructive jaundice, and imaging confirmed a small tumor. Early surgical intervention helped stabilize his blood sugars, ease the fatigue, normalize digestion, and improve his overall quality of life. Experiences like these, and hundreds more I've encountered, demonstrate clearly how concentrating on subtle combined patterns early can produce dramatically improved outcomes. Now let's move to the precise protocol I rely on daily in my practice, the early protocol. The name highlights that identifying patterns early really changes everything. It's typically outlined in 5 core steps, but I frequently expand it to 6 to stress thoroughness. First step, track changes carefully and consistently. Develop the routine of weighing yourself weekly, recording appetite levels, any abdominal or back discomfort, patterns of fatigue, stool appearance and texture, and blood sugar fluctuations if relevant. Keep it straightforward, use a simple notebook, a phone app, or whatever works best. Note the dates, rate the intensity on a scale of 1 to 10, and include related details like meals or activities. Patterns tell a much fuller story than isolated moments. Research from the Mayo Clinic indicates that consistent tracking shared with a physician can improve detection accuracy by as much as 40%. Bring those notes to your appointments. Be specific. Instead of saying, "I've lost weight," say, "I've lost 10 pounds in 3 months. I feel full quickly after meals, and my stools have been pale recently." Details like that prompt the appropriate tests. liver panels, bilirubin checks, imaging, and beyond. Second step, address modifiable risk factors directly. If you smoke, prioritize quitting, maintain a healthy weight through balanced eating, keep alcohol intake low, manage diabetes or prediabetes well if it's present. Data from the Cleveland Clinic shows these adjustments can reduce risk progression by 20–30% in those more vulnerable. Incorporate more fiber-rich foods, lean proteins, and healthy fats to support digestion and stabilize blood sugar. Third step, request the appropriate tests once patterns emerge. Start with routine blood work to check liver enzymes, bilirubin, and, if suitable, tumor markers like CA19-9. Progress to imaging, an abdominal ultrasound, a CT scan focused on the pancreas, or an MRI for detailed pancreatic views. Early small lesions demand persistence. If symptoms continue without explanation, keep pursuing answers. Fourth step, emphasize supportive everyday habits. Stay well hydrated, select nutrient-dense balanced meals, engage in gentle regular activity such as walking or light strength exercises, and nurture digestion overall. Studies in gastroenterology show that nutrient-rich eating during early symptom stages helps preserve energy and lessen problems. A tip: if enzyme levels appear low, doctor-guided digestive enzyme supplements might improve absorption, but only with professional supervision. Fifth step, integrate everything for true empowerment. Commit to acting on subtle signals rather than dismissing them as aging. Following the early protocol regularly typically leads to clear improvements. In the first week, patterns clarify and anxiety lessens with a solid plan. Week 2 frequently includes test results and minor diet or hydration tweaks that begin boosting energy or comfort. Weeks 3 to 4 direct next steps, referrals, additional imaging, adjustments, and many notice daily gains. After a month or longer, it fosters stronger long-term management, greater potential for early detection, and wiser health choices. This is proactive, organized empowerment, not passive waiting. Important notes: the early protocol is not a medical treatment or substitute for professional care. Never alter or discontinue medications without consulting your doctor. If you have other conditions such as heart or kidney problems, discuss major diet, supplement, or exercise changes with your physician first. Begin gently and safely. The focus is on awareness, timely evaluation, and intelligent risk reduction, not self-diagnosis. My challenge for you: pick one element, perhaps beginning a symptom journal or making one lifestyle adjustment like adding more fiber or cutting back on alcohol, and commit to it for a full 30 days. Then come back here and tell me what you noticed or experienced. Your body has supported you loyally for decades through every difficulty. It merits more than hasty, it's just old age explanations for persistent changes. Paying attention to those quiet signals provides real power, better insight, and broader possibilities moving forward. If this information connected with you and felt helpful, please subscribe. Next week, we'll cover hidden signs of liver disease in older adults, including one that catches many by surprise. Another often overlooked sign is a noticeable decrease in appetite or feeling full remarkably quickly after starting to eat. It usually develops gradually. After just a few bites, you suddenly feel completely stuffed as if you'd eaten a large meal. Foods you previously enjoyed may lose their appeal. Some experience mild nausea without actual vomiting. Others simply lose interest in eating. While appetite can naturally decline somewhat with age due to metabolic shifts or changes in taste and smell, fresh, persistent, unexplained changes warrant attention. Pancreatic issues can delay digestion and create pressure that affects how the stomach empties, leading to malnutrition and additional weight loss even when meals aren't skipped. When someone tells me, "I just don't feel like eating anymore," I probe further. How long has this been going on, and what else is occurring? Closely connected are shifts in bowel habits, topics people often feel awkward discussing, so they go unmentioned. Stools may become pale, oily, bulky, difficult to flush, or float more often, or new constipation or unusual texture might develop. These changes frequently stem from reduced bile or enzymes reaching the intestines. Undigested fats produce greasy, foul-smelling, floating stools, sometimes with jaundice, sometimes without. Older adults commonly attribute this to diet or medications, but new unexplained alterations should prompt a conversation with your provider. Unexplained fatigue or weakness is yet another sign that's simple to miss. Tiredness tends to rise with age from sleep pattern changes, reduced activity, or ongoing conditions. But profound, unrelenting exhaustion despite adequate rest or diminished stamina for routine tasks stands apart. The body diverts energy to fight hidden issues. Deep fatigue can serve as an early clue. On its own, it's rarely an emergency, but paired with weight loss, appetite changes, or pain, it carries much greater significance. A less common but noteworthy sign involves unexplained blood clots, abrupt leg swelling, redness, warmth, pain typically in the calf or thigh, or if the clot travels to the lungs, shortness of breath, chest pain, dizziness, or rapid heartbeat. Certain cancers, including pancreatic, can quietly elevate clotting risk without typical triggers like prolonged immobility or recent surgery. In some cases, a clot becomes the initial hint that leads to investigation. Clots arise from many causes, but unexplained ones in this context deserve closer examination. The real power lies in recognizing combinations rather than single symptoms. Appetite loss alongside unintended weight loss, stool changes with jaundice, fatigue with dull pain, new diabetes with digestive problems. One isolated sign might be benign or age-related. Several appearing together become significantly more concerning. Your body tends to group signals when something serious is developing beneath the surface. Far too many older adults remain silent about these changes out of concern, fear of appearing overly anxious, being dismissed, or learning something troubling. But bringing them up demonstrates strength and intelligent self-care. Providing a full list of symptoms gives your doctor crucial context for the right testing. Be factual and detailed, include duration, how it's progressed, and the complete picture. Then come back here and share your observations or experiences. Your body has carried you faithfully for decades through every challenge. It deserves more than quick, it's just old age dismissals for ongoing changes. Tuning in to those quiet messages gives you genuine power, clearer understanding, and wider choices ahead. If this resonated and felt useful, please subscribe. Next week, we'll discuss hidden liver disease signs in older adults, including one that surprises many people. Another frequently missed sign is a clear drop in appetite or feeling full very quickly after beginning to eat. It often develops slowly, a few bites in, and you suddenly feel stuffed like you've eaten a huge meal. Foods you once loved may no longer appeal. Some get mild nausea without vomiting. Others just lose interest in food. While appetite can dip somewhat with normal aging from metabolism or taste and smell changes, new persistent unexplained shifts need attention. Pancreatic problems can slow digestion and create pressure affecting stomach emptying, causing malnutrition and more weight loss even without skipping meals. When someone says, "I just don't feel like eating," I dig deeper. How long? What else is happening? Related are changes in bowel habits, often awkward to mention, so they're ignored. Stools might turn pale, oily, bulky, hard to flush, or float more, or new constipation or odd consistency appears. These often result from less bile or enzyme reaching the intestines. Undigested fats lead to greasy, smelly, floating stools, with or without jaundice. Seniors often blame diet or meds, but new unexplained changes call for discussion with a provider. Unexplained fatigue or weakness is another easy to overlook sign. Tiredness increases with age from sleep shifts, less activity, or chronic issues. But deep, constant exhaustion despite rest or lost stamina for simple tasks stands out. The body redirects energy to combat hidden problems. Profound fatigue can be an early indicator. Alone, it's seldom urgent, but combined with weight loss, appetite issues, or pain, it's far more meaningful. A rarer but notable sign is unexplained blood clots, sudden leg swelling, redness, warmth, pain, often in the calf or thigh, or, if it moves to lungs, shortness of breath, chest pain, dizziness, rapid heartbeat. Some cancers, like pancreatic, subtly increase clotting risk without usual causes like immobility or surgery. Sometimes clots are the first clue prompting evaluation. Clots have many causes, but unexplained ones here warrant deeper look. The true strength comes from seeing combinations, not isolated symptoms. Appetite loss with unintended weight loss, stool changes with jaundice, fatigue with dull pain, new diabetes with digestive issues. One sign might be harmless or age-related. Multiple together become much more concerning. Your body often clusters signals when something serious brews underneath. Too many older adults stay quiet about these changes out of fear of seeming overly worried, being brushed off, or discovering something bad. But speaking up shows strength and smart self-care. Listing multiple symptoms gives your doctor essential context for proper testing. Be factual and specific. Duration, progression, full picture. This guides urgency and steps. Blood tests for liver or inflammation, imaging for pancreas views, possible specialist referral. It's about collecting facts, not instant diagnosis. Prevention steps help too. No smoking, healthy weight, good blood sugar control, limited alcohol. Family history of pancreatic or related cancers. Tell your doctors it counts. These don't erase risk entirely, but improve chances and build resilience. My core advice is simple. Stay alert to persistent, unexplained changes. Don't default to just getting older for every shift. Aging brings gradual, predictable changes, but not sudden, clustered, unexplained ones. Your body whispers messages constantly. Learning to hear them and respond early keeps you in control with more options. If any signs ring true, act, contact your doctor, note details beforehand, maybe bring a loved one for support and accuracy. Action brings the best information, not fear of the worst. Awareness builds the base. Action unlocks better paths. Please share this with someone over 60. It could make a real difference, maybe even save a life. These discussions may feel uncomfortable at first, but they're essential. Tracking remains central. Log weight, appetite, digestion, fatigue, blood sugar in a journal or app. Track onset, changes, patterns. Bring notes to visits. They catch subtle things doctors might miss otherwise. Review meds periodically. Some affect digestion or sugars, so separating them from warnings helps. Involve family or caregivers. They often spot what you don't. A companion at appointments adds perspective and ensures details aren't forgotten. This full approach, regular monitoring, smart lifestyle choices, nutritious balanced eating, hydration, gentle exercise, stress and sleep attention, supervised supplements if needed, and close teamwork with your medical providers strengthens pancreatic and overall health meaningfully. No guarantees exist, but these tilt odds favorably and prepare for quick, effective response if needed. Spotting these signs isn't about creating fear, it's about real empowerment through knowledge and practical steps. Keep watch for unexplained weight loss, appetite shifts, fatigue, digestive changes, new or worsening diabetes. Respond with steady tracking, healthy habits, and timely medical checks for the strongest health in later years. Pancreatic cancer exemplifies how grave conditions can start so quietly, with hints too easy to miss. We often expect sudden, obvious onset, but it usually builds gradually through understated clusters. When they combine, don't dismiss them. Your body messages you always. Learning to listen is crucial. Early response isn't assuming doom. It's proactive care preserving options. Blend strong awareness with practical actions for greater health control. Share this message widely. It can change lives. Empower yourself and loved ones. Transform quiet whispers into timely, clear signals for better results and peace of mind.